And it's a pleasure now to welcome Michel and Jacqueline to the stage. Michel is here, Michel White is here as a patient representative, and Jacqueline Purr is with the Fraser Health Region, and her job is all about the patient experience. It's actually her role to ensure that the patient experience in this health region is a good one. So the two of them are going to talk to us about their experiences in these roles. We'll be able to tell how much they like each other depending on how closely or how far away they sit.
I thought you were going to sit here.
I'm teasing. I'm going to sit on this end so you guys can cozy up.
We're playing musical chairs.
We will, we can. Okay, so it's all about you. Patient-centered care, huh? Michelle, as I learned when we spoke on the phone the other day, started to identify herself as a patient when she was 8 years old. Had her first encounter with the medical system. The next one after that happened when she was 11, and so on throughout her life. The kinds of experiences she's had in healthcare would level most of us. Brain tumors, various respiratory illnesses, various interactions with acute, emergency, and non-emergency care. And here she is, sitting in front of a room of people, hell-bent on ensuring that the patient voice is heard. Welcome. Thank you so much for being here.
Thank you.
Tell me a little bit about why you said yes to the conference organizers.
It's important for me as a patient to get not just my voice heard, but the voices of patients who may not have a voice or may not know that they have a voice. And if I can speak to one person and make a difference, then to me it's worthwhile.
What's the difference you want to make?
The difference I want to make is I want health care to be for every patient. I want it to be available to every patient. I want it to be so that patients are treated with respect, so that patients are treated not as a condition, but as a person.
Let's talk a little bit about a couple of your experiences. Brain tumor number 1. You went in for something different and ended up with a diagnosis that was kind of, what the heck?
What happened was I'd had my daughter, and I was very, very sick when I was pregnant with my daughter. And they couldn't understand why I had been so sick. And I mean, I was sick for 7 months of pregnancy. When I delivered her, I had a normal delivery other than my placenta tore, and she came out. She was a normal, healthy baby girl. She had no issues. I nursed her until she was 6 months old, and when I stopped nursing her, my milk wouldn't dry up, and my periods, when they came back, were very irregular. My doctor didn't seem to think it was a problem. And then my dad, when he was about 49, had his first massive heart attack. And so I said, well, if you're not going to send me, because we were living in northern BC, and I said, well, if you're not going to send me down south to see a specialist about this other things, then I want to see a cardiologist. So very begrudgingly, he sent me to see a cardiologist, and
that was a proactive thing because you wanted to make sure that you didn't have the condition
that I didn't have the condition my father had. So he did the tests that were available at the time, and he said, there's nothing wrong with your heart, but because of your condition, and to me, this is the way medical systems should be. He said, because of your condition, I want you to see a neurologist friend of mine who I saw the next day, and I had the test done, and they didn't show anything, but he got a second opinion, and that's when they found my first tumor sitting at completely engulfing my pituitary gland.
So did you have a sense that something was off?
I knew something was wrong because I had lost my peripheral vision, and I was so sick with my daughter. And then when I stopped nursing, you just don't feel right. You don't feel good. You don't feel well.
Jacqueline, as you listen to Michel's story, what are you thinking about?
I think, well, thank you for coming today and sharing it with us. I think it's so powerful when we hear from our patients their perspectives and how the experiences that we provide, how it lands back on you, and just having that sense of wanting to be that partner in your care and bringing your concerns forward. And I know my body, I know something's not right. I don't know what's not right, but I know something's not right. And having those conversations with the care providers in your community to say, how do we figure this out?
How easy was it for you to develop those relationships with the care providers, to be able to say, hey, look at this?
Well, when I lived in northern BC, it was very difficult because the doctors up there all know each other. They all know the patients all know each other. And it was far more difficult because the doctor I had felt that even when they found my pituitary adenoma, they felt that he felt it was a white elephant. And so it was not the reason for my issues. And he struggled with me coming down to see the doctors and coming to get tests done. And so it was very difficult.
So there was a feeling that you were going above his head to be able to get these answers?
Oh, I often went above his head.
Okay, so I don't want to minimize the issue that happened then, but I do want to sort of explore this idea about how you became an advocate for your own health. So as you go along through your life and different things start to emerge, different issues in health, how did you start to assert yourself and make sure that the doctors and the caregivers had your story as you went in to develop relationships with them?
There were a couple of things that happened. One of them was that I had an endocrinologist after my initial surgery, and they wanted me to have radiation, and I wouldn't have radiation because they said they got the whole tumor, and to me it didn't make sense. So when I came back down and the tumor had grown back to almost its original size and they wouldn't operate again, and they said to me, well, basically they laughed at me and said, well, now you have to have radiation and we told you so. And so I had to have 6 weeks of radiation, external beam radiation therapy. But the endocrinologist that I had at the time, he said to me, I'm the doctor, you're the patient, and I'll tell you when there's something wrong with you. And I decided that it was at that time that I said, no, yes, you're the doctor, and yes, I'm the patient, but this is my body, this is my health, and I'll tell you when there's something wrong with me. Because I realized that I have a voice. Yes, I come to the doctors for advice, and yes, I come for help and ways of working through this, but we're a team and we work together through this. It's not you telling me what to do and you telling me how to do it. And I've had a few doctors who have tried to do that, where I will tell you what has to happen, and I say, no, you won't tell me. We will work together. If it works, great. If it doesn't, oh well, we'll try something different.
But let me be the devil's advocate. I'm the doctor. I've got all the training. I'm the endocrinologist. I know what to tell you how to do. So there's a power thing to that.
So what I have done is I have actually seen a doctor because I was having severe dizzy spells. And I went in to see him, and I had a list of questions. And he says, oh, I don't have time to do your questions. We have to do a physical. Why do you need a physical? I have questions. And what I have done is, first of all, I didn't go back to see him. And second of all, I have actually walked out of appointments, because if you're going to treat me like crap, I have no respect for you. And if you're not going to respect me, I'm not going to respect you. And yes, I know you've got the training, and please, no disrespect to anybody. I know you've got the training. But if you're not going to work together with me and help me understand my condition, then I don't want to work together with you. Because frankly, at the end of the day, we all put our pants on at the same way, one leg at a time. And so, yes, you've got more training, but it's also my health.
Jacqueline, how do you work with your teams and healthcare providers to ensure that that power is balanced and that the patients do come into the relationship with some agency for themselves?
Well, I think, when you're speaking, it's, you're talking about some of the experiences that you've had, but I think it's what we experience every day, regardless of who we're working with in our interprofessional teams. Not everybody feels they have a voice to say something to the senior nurse or the supervisor of the lab technologists. So it's really about how do we create those spaces where people feel that they have that ability, that they're bringing some value to the conversation. And part of, as healthcare workers, we're trying to gather information from you as a patient and asking those questions to try to figure out, where do I think I need to go? But that's where I think when you're talking about how do we ask about the voice of the patient and incorporate the voice of the patient to say, tell me what this has meant to you. Tell me what you're thinking this is about. Because patients are very well educated these days. We joke about Dr. Google, but patients come very well prepared to physician appointments, to even getting their lab work done. They know exactly why they've got the test and why they need it and what's going on, and they've got questions. And I think that's sometimes difficult for us as healthcare providers. We're not used to having those questions come or take a sense of that they're questioning my judgment, and that's not it. It is really about sharing that understanding so that we take that journey with you. And I think that's what people come to work to do every day. We come to work wanting to empower and enable the joint partnership for care with patients. And some patients are very vocal and very articulate and wanting to step into that. And others need a little bit more coaching. So it's finding that balance and that dance between us and the patients, but also within our own interprofessional teams about recognizing who's got a relationship or who's best to work with that particular client or family at the time.
The reason I was laughing is that I won't let my husband and daughter go on to Dr. Google because they pull off every possible worst scenario that they can find, and so they're not even allowed to see Dr. Google at all, and it drives me crazy.
Yeah.
But another part of that is what has tended to happen over the years is not so much family doctors, but the higher up a specialist goes, they tend to feel a lot of times like, look at me, I'm on a pedestal, and I'm not putting everybody into a box. It's the people that I have seen tend to do that. And I want you to look up at me, I want you to bow down to me, and I will tell you what is wrong with me. And as far as I'm concerned, that's a scenario that has to change. The scenario of the nurse coming in and saying, you have to take this is what's wrong with you, the doctor said. I'm sorry, I don't care what the doctor said, I cannot take this. So yeah, it goes along with that, but I think the relationship has to change where the doctor has to realize that he's working with the patient. He's not the all-knowing, because my family doctor, I know you're going to talk about this, but my family doctor is phenomenal.
In Abbotsford.
In Abbotsford. He is phenomenal. And he's the second one we've had in Abbotsford in 27 years. And the only reason we've had two is the first one passed away. He had pancreatic cancer. And we found this one.
So you walk into his office and you hand him this.
I hand him my medical letter. It actually looks like this. It's colored. It has my name, my healthcare info. It has my emergency contacts, all my medication, all the surgeries I've had, family medical history. And I walked into his office for the appointment, and I handed it to him, and I said, this is my condition. And he looks at it, and he reads it over, and he says, well, I don't know much about your condition, but he said, I'm willing to learn. And I said, you're hired. I've now had him for 16, 17 years. And what I love about him is he will say to me, I saw him yesterday, he will say to me, I don't know what's going on, but this is what I think. And I see him every month for blood work, for medication, and he will say, why don't we try this and see if it works? Why don't we do this and see what happens. And I'm okay with that. I have a lifelong medical condition. I know that. I don't like going in to see the doctor. I don't like taking medication. I wish I never had to take another pill again in my life. But I have to live on medication for the rest of my life because I have an empty cella. I don't have a pituitary gland. But I have an amazing physician who works with me, who helps me understand, who does things for me and with me to help me.
How do you move to that we scenario where the patients and the doctors and the care providers work together to problem solve?
I think that's one of the intentions of this day today. You know, it's understanding that there's inherent challenges in all our relationships, and you know, you see so many providers when you're coming in, and we have to connect with so many other different providers as part of your care. And it's understanding who we are and what we do and building those relationships and that trust in one another, that we've got good, strong communication networks, that we are sharing the information in a timely way, that your voice is being brought forward through it. But I think it's so important, you know, and I'm curious how it makes you feel when you say to your doctor, you know, this is who I am, and he says to you, how do we take this journey together, Michel? What can we do? How does that land for you as a patient? Because I think we all think we act in that way, that we engage patients in that way. But I don't know if we ever step back and reflect, you know, what does that really mean to you as a patient?
I find as a patient that when I have a doctor, whether it's a family doctor, a neurosurgeon, or an endocrinologist, who treats me with respect and wants to know what I think, I feel like I'm part of the team. And I feel like I have a voice because it is my health. I'm the one who lives it every day.
But you have to be nice too. Right?
It's about respect. It's about joint respect.
I'm teasing her because she was saying that sometimes those patients walk in and they're telling doctors what to do. And Michel made a very strong point when we were talking the other day that, you know, she's had to learn how to have the conversation in a way that doesn't make the caregivers feel like, here she comes again.
Yeah.
So what have you learned?
Well, I had to see a plastic surgeon years ago for growth removal under my eye. And he was asking about different surgeries I had as he's working on my eye. And I told him I had had a full knee replace, my full knee replaced. And he asked who my surgeon was. And I told him when I first met the surgeon that, you know, he came across as being really bad bedside manner. And I said, but now I find that he's amazing. And I call him my Energizer Bunny because he's just constantly going, 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 going. And he said, well, you know what? There's this thing about us surgeons. He said, we're so used to talking to people when they're out, when they're non-talking. He said that we tend to have a terrible bedside manner. But he said, if you can get past that and learn that we're real people and that we can actually talk to you when you're awake, he said, you can discover our personalities. And I think that's been a big part of it for me, especially because I deal with so many surgeons. Like my neurosurgeon was the same way. And my neurosurgeon's amazing, absolutely. He said to me, when I had my last brain tumor, I've had 3 brain tumors. So when I had the last one removed, he said, we can do one of 3 things. We can leave it for 6 months and see what happens. We can do radiation, which I don't want to do because apparently they gave me too much radiation when they did it back in '86. Or he said we can remove the tumor. Now, when I had this last tumor, I'd had a headache every day for 4 years. I was not without a headache for 4 years. My personality had changed so that the kids at school were afraid of me. The teachers noticed the personality change. So I said to him, I would like to have it removed. And he accepted what I said and went along with it, and we had it removed. And he came back and he said to me, I'm glad we removed it because it would have had to have come out. But he listened to me. And he could have said, well, I think looking at it, we should wait 6 months. But he didn't. He took it out and then realized that it needed to have come out. So for me, that was huge because we worked as a team. It wasn't a he said, she said. It wasn't a power struggle. It was us working together. So,
All of the people in the room are going to be working together today, thinking about being teams, thinking about how to have relationships with each other. I'd like both of you to just offer a couple of words of wisdom. What would you like people to be thinking about as they enter into this dialogue today about patients and relationships in healthcare?
Go ahead.
I think a big part of it is respect. It really is. It's, you walk into, whether it's a room, whether you're a lab tech or a nurse or a doctor, a surgeon, whatever your role is, and you walk in and you treat each other with respect. It's not just about me respecting you or you respecting me. I am not my medical condition. I am a person. And I always tell people that 95% of your healing is your attitude. 5% is medical, 95% of it is your attitude. So if either of us walk in and we've got a really crappy attitude, it's going to come back as a really crappy attitude. You treat me with a bad attitude, I'm going to come back at you with that. And that's not going to help my medical, my 5% medical. So working together as a team, a big part of it is our attitude. It's respecting each other.
Thank you.
And can I just say one more thing? Can you remember in all of this, if you don't remember anything else, don't ask what normal is, because normal is a setting on a dryer. That's all it is. Your turn.
It's hard to follow that. You know what? I think what I'm hoping that from today we really keep your story and what you've shared with us as kind of that fulcrum of our conversations today. I think as we move forward, we're hearing how patients want respect, how they are prepared to give respect back and be true, engaged partners in care. But it's how do we navigate some of that with ourselves too? How do we show up at work? How do we think about the opportunities to innovate and be creative and try new things using our knowledge, skills, and expertise as various health discipline professionals and bringing the patient with us in that journey, not planning it and then bringing the patient in to have a conversation to see does this make sense to the patient. But it's really having our patients and families at the tables with us to hear our crazy ideas or things that we want to try and not being afraid that we can't fail as healthcare providers in setting the stage for the future, because I think healthcare is changing. It's evolving so quickly every day. But if we're not in a dialogue, a true dialogue with our patients and our families and our community around what healthcare means to them, what they want out of the journey and the system, we can never deliver on those expectations. So how do we partner together and how do we leverage off each other and our skills and experience? Because you've had, I think, probably some very positive experiences with nurses and lab technicians and x-ray and some not so positive experiences, right? And we're part of a bigger team and a bigger structure that intersect with so many different areas, whether you're at the front line or whether we've got ministry partners here today too, and they're charged with, setting forward the strategic directions and supporting that accountability for us as a province to the care of our patients. But how do we help them understand what it is that we want, right? And it's that dialogue that I think we're going to have today around how do we work together.
Right. Thank you both so much for getting us set up this morning. Really appreciate you being here. Please help me to thank Michel and Jacqueline.
Thank you.